This is the way we can stop the spread.
The state health department putting into place a new $43 million tracking program to fight the coronavirus. But there's also uncertainty for workers, some worried about sacrificing their health for a paycheck. It's one of the biggest questions on Hoosiers' minds. What is Governor Holcomb going to do when this stay-at-home order expires on Friday? Wish TV's Dan Klein joins us now live from the State House with the latest on that. Dan.
Well, the governor is still refusing all efforts to try to get a preview of what Friday's announcement will look like. But it seems like a few key pieces are starting to fall into place. But based on what other states are doing, there are some fears that some people have to choose between their family and their job.
I'm not going to release the timeline today nor tomorrow, by the way.
Governor Eric Holcomb keeping plans to himself, but new plans released for the post-coronavirus world. The state finalizing details for a contract with a company called Maximus to staff 500 positions to make calls to Hoosiers who test positive for COVID-19. It's a time-consuming process. It will take about an hour per person to figure out who they've been in close contact with, an average of 10 people per case. Then they will be contacted. Each will have to isolate for 14 days, though a test will not be needed unless symptoms start appearing. It takes the burden off local health departments. The annual cost estimated at $43 million. But the program isn't set to begin until May 11th.
An important requirement for us being able to open back up in our state is that we must be able to test individuals quickly and isolate them if they are positive.
In Iowa, where restrictions are loosening on Friday, state officials say people who don't go back to work when asked by their employer will be considered to have quit voluntarily and lose their unemployment benefits. Even if they don't feel it's safe, valid excuses are limited to things like being sick with coronavirus or not having child care available. When Governor Holcomb was asked if Indiana would do the same, he skirted the question, instead focusing on the demand for high-wage jobs he believes will still be there once the state gets going again. Officials say the focus right now is getting benefits out to those who qualify. There will be webinars for both employers and employees explaining requirements.
Once individuals are asked to return to work, legislatively, they are required to return to work.
More answers on this topic are promised for Thursday. The state also announced today that it has purchased a specialized decontamination system for hospitals and healthcare offices throughout the state. Hopefully starting next week, they'll be able to send in their N95 masks to be cleaned at a centralized location, and then they'll be returned. And that process can happen up to 20 times before they get tossed, so that really extends the lifespan of those masks. Brooke?
And Dan, before we let you go, the governor also talked about the Indy 500 today. Touch on that.
Yeah, some good news for people hoping to go to the race. Of course, it's been moved from May until August. The governor says if we continue on the path we're on, he hopes the race will happen with people in the stands and not needing to wear masks, but with one big caveat: people with some higher risk factors, especially those above the age of 65 and with some underlying health conditions, really should continue to avoid larger crowds like the 500 until further notice, perhaps until a vaccine is available.
All right, Dan Klein live for us at the State House this evening. Dan, thank you very much.